Hi, I'm Saima. I am the head trainer at CareCraft-Academy. This is my series about real-life challenges faced in the health and social care sector that sometimes individuals feel afraid to disclose. So one more thing before we start. We will be maintaining confidentiality, and we have gained permission from providers to utilise these scenarios to raise awareness and improve practices. A customer made contact with CareCraft-Academy and requested for catheter care training for their workforce. The challenges that the customer were facing were that staff not always had access to wipes or dry wipes whilst supporting individuals with catheter care. Staff members were also, in relation to indwelling catheters, inflating the balloon in the bladder when they felt that it had been misplaced without making contact with district nurses. Staff were carrying out techniques that they were not trained to in fact deliver or provide. The challenges for the customer here is that their staff are participating in activities that they have not been trained to do. Furthermore to that, they are not in fact working in line with their job description. They are not making contact with district nurses or the senior management team to inform them that they have a concern in regards to the indwelling catheterization. The resolution that we sought during training, I educated staff on the consequences of their actions. If you haven't received training, you should not be completing such activities. Part of our role as support workers is to make contact with GPs, with district nurses, with social services, and I encouraged that workforce at that moment in time to start using their initiative. Contact your senior managers, clarify the approach that you're going to take, and if they agree with you, proceed with making contact with district nurses. Clearly document it so other staff members and the senior management team are in a position to review and establish that that member staff has escalated the situation and they've got the right support that they need. Support workers were also encouraged to make contact with the NHS 111 service to seek further advice and guidance on how to record this contact within their daily records. The provider now has high standards. Their staff are no longer completing activities which raise concern. The resolution that we've sought here is that the staff employed now no longer carry out activities that they are not trained to carry out. If they have any questions, they know how to contact their senior support workers or their team leaders, and they are clearly documenting any concerns that they face whilst providing regulated care, support and supervision, and they're fully aware of who they need to contact. This provider also ensured after the training that they had uploaded all key external contact details on the electronic call monitoring app. During their staff meetings, they would carry out simulation activities after this particular training, just to ensure that staff were familiar on where and how they can gain further support, and how to make contact with external agencies, and how to clearly document that within that particular electronic call monitoring app. The provider also contacted the family members who do not have wipes or dry wipes available for staff members to use whilst they're supporting their clients with catheter care. The management team, in fact, visited these service users whilst their family members were present, and it was a win-win situation for both sides. Once family members were informed of the consequences of staff members using towels or using kitchen towels to clean around a catheter site, family members then purchased wipes, and they were working closely with support workers when supplies were low. So if supplies were low, support workers and carers were able to inform family members that they were low on resources, and family members then became quite responsive where they were purchasing wipes to be used during catheter care. Let me know what your thoughts are. Leave me some comments below.